Coming up, we will be on location at Dr. Dmitry Nurminsky's dental practice in Bowie, Maryland, discussing the benefits of dentistry and how they can help improve your dental health and give you the beautiful smile you've always desired with one of this region's top dentists, Dr. Dmitry Nurminsky. Dr. Nurminsky received his DDS degree from the University of Maryland Dental School and has many years of experience and is widely recognized as one of this region's top dentists. Welcome, Dr. Nurminsky. It's a pleasure having you on our program.
Same here, of course.
It's your first time, in fact, on the Top Doctors interviews. We have a lot to talk about. We have some patients of yours that we're going to hear from a little bit later. But I wanted to begin, if I may, Doctor, by having you tell us about what some of the benefits of dentistry are and why it's so important for patients to visit a dentist regularly.
Dentistry is all about oral health, and it has great relation to general health. In fact, according to World Health Organization, a person without teeth meets the criteria for being physically impaired, handicapped, and disabled.
Oh.
And oral conditions can be a source of pain, both acute and chronic. And chronic pain may make people very unhappy and continuously unhappy. And that has a very big relation to psychological health as well.
Yeah.
If we add aesthetics and maybe bad odor that sometimes happens, that may impact social life and professional life. About 3/4 of American people consider a smile as a big factor in their professional advancement.
Yeah.
And the same proportion of people are more likely to trust someone with nice smile more than to someone with nice clothes or driving a nice car.
Very interesting points.
Yeah. So overall, there are very many facets of our life that are related to oral health, and it's actually hard to imagine anything that's not.
Yes, indeed. No, you're absolutely correct, Dr. Nurminsky. And another key point that a lot of folks don't realize is that our oral health directly affects our overall health in many cases.
Yes. It's pretty well known that oral infection, if it spreads beyond the mouth, can kill you.
Yes.
And regrettably, there are several cases of that, which are widely known.
Yeah.
But the other condition that is more prevalent and is just as likely to kill a person is oral cancer. Every year, almost 50,000 Americans are diagnosed with oral cancer, and almost a half of those people die within 5 years.
Very high rate.
Very high mortality rate, 57%, and it's been at this level for many years, whereas mortality rates for other cancers have declined considerably. And that is mainly because oral cancers are usually diagnosed too late. Because people who don't visit dentists on a regular basis come to dentists or other health professionals when something starts hurting or when there is a lump in the mouth. Yeah. And in these cases, it's unfortunately sometimes too late for efficient treatment.
And that's why it is so important for that and many other reasons that you mentioned, why folks need to come for regular checkups and cleanings,
Absolutely,
right? To a dentist.
Yes, it's recommended to have it every 6 months.
Okay. And I wanted to also ask you, Dr. Nurminsky, what are some of the more common dental problems that you see in patients that come to your practice?
Bite problems. About 10% of adults have temporomandibular joint disorders, which are the joints that connect the jaw to the cranium. Other problems are tooth decay, of course, although it's less and less of that with increase in oral hygiene and fluoride in water and things like that. Missing teeth and periodontal disease or bone loss.
So those are some of the more common ones that you're seeing in your patients. And I also understand you offer cosmetic services here at your practice?
Well, every part of dentistry is cosmetic in some aspect. For
Yes.
example, if someone is missing a tooth or the tooth is unsightly and it has to be restored, that's a cosmetic procedure.
That is
right?
true, yes.
In addition to those, we certainly offer veneers and tooth whitening.
And you have a very unique approach, and that's one of the things that intrigued us about you and your practice. You have a very unique approach towards dentistry. Can you please tell us a little bit more about that?
Well, there are two parts of it. One is that we certainly recognize that oral health and general health are interrelated. So we usually take great care about figuring out what the medical history of the patient is, and what is the blood pressure and so forth. Because it's been quite well established that, for example, diabetes has a direct link to periodontal disease, and a person with uncontrolled diabetes is much harder to treat for periodontitis, and vice versa. So people with periodontal disease have more problems with diabetes.
Very interesting.
There are other general health conditions that are linked to periodontal disease, or, for example, loss of teeth. For example, people that have no teeth are twice as likely to have lung disease, rheumatoid arthritis, dementia, things like that. It's not really clear whether there is direct relation between those, but there might be, and it might be linked by inflammation in the mouth.
Oh.
So we consider these aspects. Our goal is to consider the dental problems in the context of the overall health.
You go off of that approach in a lot of your guiding decisions.
Yes. Also, we consider the patient's interests. Then we take great care to figure out objectively what's going on in the mouth.
Okay.
And we discuss it with the patient. We educate them about the conditions that they have, about the treatment modalities. We don't force the choice of treatments. We help to make decisions.
So it's a customized approach.
Absolutely.
As far as your
customized.
treatment plans based on each particular patient's needs.
Yes.
What are some of the treatments that you offer over here that help your patients?
Well, we offer a very broad range of treatments, between general exams and cleanings, to fillings, to crowns, bridges, implant restorations, veneers, bleaching.
So it covers the whole gambit, from just routine visits right on through to some detailed advanced procedures, because you really have a state-of-the-art technology-equipped practice, I must say. You have all the latest and greatest in technology.
Yeah, we recently even started doing the therapeutic Botox injections for people who suffer from temporomandibular joint problems, because the bite issues that cause people to clench and grind have been linked to tension headaches and migraines. And one of the modern ways to treat it is Botox injections into chewing muscles here and there, and that usually just removes headaches and soreness of the muscles.
Very interesting. See, I wouldn't have thought that. But here, your Botox injections, what we normally think they're used for, right? This particular case, they're actually helping with TMJ problems.
Yes.
Now, what type of results are you seeing, Dr. Nurminsky, in all the various treatments you offer for your patients?
Well, our goal is to make teeth look like teeth, right?
Yeah.
So now we try to avoid the treatments that, indicate themselves immediately as fake teeth.
Yes. Yes.
So we try to use the materials and methods that produce very natural results, aesthetically appealing.
Yes.
And again, the color of the teeth that are new is usually the choice of the patients. Our general advice is to match that to the existing teeth, but we certainly follow the desire of the patient.
Yes, because you made a great point again, and that is when someone's having a cosmetic treatment, for example, done, right? Whether it's a dental cosmetic treatment or another type of cosmetic treatment in skincare or facial rejuvenation, just as some examples. The last thing we want when we have a cosmetic treatment is to look like we had a cosmetic treatment.
Absolutely.
We want natural results, right?
Yes.
And from what I've seen with your patients, and your cosmetic patients in particular, Dr. Nurminsky, you really are getting some great natural results where they look great, they've got their smile back, but they've got it in a way that's very natural and doesn't look like they had something cosmetic done. And I think that's very significant.
Yeah, and the latest advances in the materials and technologies for tooth restorations are really facilitating that. And we use the labs with the best protocols and the most modern equipment just to get the best results.
We're now going to meet some patients of Dr. Nurminsky. Welcome, Stephen. It's a pleasure having you on our program.
It's a pleasure being here.
We always appreciate it when patients take time in their busy lives to come down and share some of their experiences with us. And on that note, I'd like to begin, if I may, Stephen, by having you please tell us how you heard about Dr. Nurminsky and what brought you here initially.
Well, I had been a patient of Dr. Kukoris prior to Dr. Nurminsky taking over from him.
Okay.
So once Dr. Nurminsky took over, I stayed with the practice because it had been an excellent practice, and Dr. Nurminsky has continued to practice in an excellent manner. I had a problem with bruxism, which is grinding of your teeth at night, and I got a dental guard which enabled me to stop grinding my teeth, and it's so comfortable that I don't grind them anymore.
Well, that's a good thing, right?
It's an excellent thing.
Yeah, because a lot of people have that exact problem with too much grinding, and it wears it down, and you just feel it just bothers you, right?
Exactly.
And so you already had been a long-term patient of the practice.
Yes.
With the previous dentist who owned it, and then when Dr. Nurminsky acquired the practice some time back, you continued as a patient of the practice, and obviously, as you just mentioned, you've had great experiences.
Oh, excellent.
Continuing forward.
Yes.
Now, as far as your experience with the staff here at the practice, what do you have to say about them?
I would say that they are patient first with patient care, and using the iPads to do your paperwork and the greeting that they give you when you first enter the door, it's just top notch. They relax you as soon as you come in, and you just feel comfortable. It's very, very affable staff.
And that's an important point you just made, because so many people have a fear of going to the dentist.
Yes.
Unfortunately, too many of us do, right?
Yes.
But yet we have to go to the dentist, not only for continued good oral hygiene, but for any dental problems that may occur, which they always inevitably do as we go through life. So it's very important that we go to a practice that we're comfortable with.
Yes.
To alleviate that anxiety.
Oh,
right?
yeah.
And as far as the results through your time here as a patient of Dr. Nurminsky's, I take it you've been very pleased with the results of all the various work you've had done?
Extremely pleased. Everything from the routine cleaning to the x-rays that have to be done periodically. Everything is always top-notch, professionally done, and done in an extraordinary manner.
And before we let you go, Stephen, is there anything else you'd like to add?
I will continue to come to this practice because it's just top rated.
Well, I think that says it all right there. And on that note, we'd like to thank you, Stephen, for taking some time and sharing some of your experiences with us and being a guest on our program.
Thank you so much.
It was our pleasure. Welcome, Gary. It's nice having you with us today as well.
Thank you.
I wanted to begin, if I may, Gary, by having you tell us about some of your experiences that you've had here at Dr. Nurminsky's dental practice and how long you've been a patient.
I've been coming to this clinic since 2000.
Oh.
Yeah, so I've been here about roughly about 16 years or so.
Long time patient.
Long time, obviously, yeah. The previous dentist, I was there as well, so always had a great experience every time I come here, which is why I always come back.
And what are some of the treatments that you've had over that time?
For the usual cleaning, every 6 months, I had some fillings done and even a crown put in one time.
Oh.
So the job really ranges, but every time, always a great experience.
It's certainly wonderful to hear that. And as far as your experience, but not only Dr. Nurminsky, but the staff here as well, what's
Sure.
that been like?
Oh, always great. Very welcoming. Every time I come here, always made feel at home. Everything is clearly explained. Appointment are very accommodating. So every time, because I'm usually seeing the same dental hygienist, so I always make sure, is that person available? So they always, without even having to tell them, they know who I'm looking for, so they schedule me properly.
That's great. And before I let you go, Gary, is there anything else you'd like to share with our viewers?
Sure. This is if you're looking for a dentist, I couldn't think of a better place to come to, because this is a great place, especially for me anyway. It's very convenient because I live in the neighborhood, so it's very convenient for me to come here. But also, it's a great place, welcoming people, very friendly staff, and very great professionals all the way around.
Well, on that note, we'd like to thank you, Gary, as well, for joining us and being a guest on our program.
You're welcome.
It's our pleasure. Welcome, Kathy. It's a pleasure having you on our program today.
Thank you.
I wanted to begin by asking you if you could please tell us how long you've been a patient of the practice.
I've been a patient since March of 2016.
Oh, so you just joined earlier this year?
Yeah, I came in the second week of Dr. Nurminsky when he took over.
Oh, okay, very good. And can you please tell us about some of the treatments you've had, some of the visits?
The reason I came here was to have a lot of work done. I was born with a birth defect that showed up when I was about 21 with a degenerative bone disease in my spine.
Oh.
So for about 25 years, I used a lot of medications that caused dry mouth and caused a lot of tooth decay.
Oh, okay.
So last November and December, I spent 2 months in the hospital with an infection in
I'm
virus.
sorry to hear that, Kathy.
Yeah, so I had a lot of infections that turned into pneumonia, and I decided when I recouped from that I wanted to take care of any infections that could happen because of dental problems. I fought so hard to get well, so I decided to come in and see what needed to be done.
Okay, so you've been doing that here since you became a patient earlier this year. And what has your experience been like with everybody?
Wonderful. The staff is wonderful. As soon as they know who you are, they recognize your voice on the phone, they know who you are, they know your name. They're very encouraging. It's a very calm atmosphere. They're like a family. They all help out. They all pitch in with each other. Even Dr. Nurminsky jumps in and helps out, even during procedures, even when he has Morgan working with him, his assistant, he helps jump in and do stuff that she would do.
That's wonderful, actually. Isn't that a great thing to know?
Yeah.
You're coming to such a warm and welcoming practice.
Yes.
I mean, from what you've told me here just now and the other patients we've spoken with as well, there's a common theme, and it's very genuine and sincere. You can see that in your face and your emotions. I'm so happy to hear that. And how is everything with you overall? You're better now than you were, let's say, 6 months ago, a year ago?
Yes.
I'm happy to hear that. Thank
Remarkably
God.
better. We're almost done with the road. Yeah.
You can see the light at the end of the tunnel, right?
Yes.
Been through a lot.
I'm actually going to miss everybody. I'll probably be coming by and saying hi.
Yes.
Yes.
Anything else you would like to add, Kathy, before we let you go today?
Oh, I would recommend him to anyone for anything that they need done for dental work. He's done various things. He's done crowns for me. He had to do a tooth extraction. He's done fillings, anything that you need done. And he's always willing to go the extra mile to keep you comfortable. My gums don't like to heal very well.
Yeah.
So when I've had temporary crowns put in, he's had to do some adjustments and had me come in after putting temporaries in while we're waiting for the permanents to come in. So he's had to come up with inventive things, like he started buffing the temporaries to make them more comfortable so that I'd be okay waiting for the permanents to come in.
Well,
So,
we're certainly happy to see you're happy.
Yes.
And on that note, we'd like to thank you as well, Kathy, for joining us, sharing some of your experiences and being a guest on our program.
thank you.
I must say, Dr. Nurminsky, the patients are very happy, long-term patients. as well here that we're talking about who have been with you for years and love the results and love the family-friendly atmosphere that you create. Because, you know, as I mentioned to one of the patients a few minutes ago, one of the biggest fears people have is going to a dentist.
Absolutely.
So the fact that you and your staff make them so comfortable and they actually look forward to coming here, I think says a lot about you and your practice.
Yeah, we certainly realize the apprehension of people who come to dentists, but we try to do our best to make them feel at home, to remove as much stress as we can, and make their stay as pleasant as possible.
Well, you're doing a great job, you and your staff, absolutely,
Thank you.
as the patients have told us. Now we're literally out of time, but I wanted to ask you before I let you go, Dr. Nurminsky, you and your practice here in the Bowie Mitchelville region of Maryland have certainly established a reputation for excellence, not only in dentistry, but also in patient care. And I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Well, I don't know if it separates it, but we follow the good rule that good enough is not good enough.
Yes.
So we don't cut the corners, we choose our materials and protocols not based on the cost, but on the efficiency.
Yes.
We use evidence-based dentistry to select the best procedures. And we understand that there is inherent conflict of interest when dentist proposes some treatment, because I'm the one who is going to get the money for the most expensive treatment.
Yes.
Right? But we put the patient's interest first, and we think about what is best for the patient, not necessarily for us.
Yes.
And as I mentioned, we educate the patients, we help them make the decision, and then the rest is really easy. We just make our effort to render the best treatment possible.
Well, you're certainly doing a tremendous job. We are very honored to have you as our top dentist for this region.
Thank you.
And we're very proud of all the work you and your staff are doing each and every day to help so many residents of this community. And on that note, we'd like to thank you, Dr. Nurminsky, for being our guest today and educating us on the benefits and the importance of dentistry, and we'd love to have you back on in the future.
Oh, that's been my pleasure. Thank you very much.
Thank you.